Good afternoon, everyone. My name is Reagan Goldberg, and I serve as the Chief Development Officer at Easter Seals, Michigan. Thank you for joining us today for our Lunch and Learn webinar. Today, our topic is called Addiction, the hidden pandemic that affects us all. This is a topic that is near and dear to many of us and is on our minds right now because it's in our homes, it's in our workplaces, it's in our families, in our schools, and our communities that we live in. We have an informative panel discussion planned for you today, as well as a Q&A time frame reserved at the end that we hope you will enjoy. Our moderator today is Dr. Jeff Ganay, our Chief Medical Officer at Easter Seals, Michigan, and he also serves as the Psychiatry Residency Director at Beaumont Health. I'll turn it now to Dr. Ganay.
Thanks, Reagan. Thank you, everyone, for joining us about this really important topic. I know that we have clinicians here, people who are interested about themselves and their loved ones, and we have a great panel. Before we get to our panelists, I do want to go over just a few facts. There's a lot of different populations that are at risk for substance use disorders and overdoses, but I think it's one population that you hear a lot about are veterans. And as someone who was in the Air Force for 10 years and served as an active duty psychiatrist, this is a population that's near and dear to my heart. But it's also a population that even for non-veterans, there's the idea of helping, the idea that people who often have substance use disorders often have underlying mental health concerns is very important to everybody, and for us to be very aware of when we're talking about people with addiction. And so I'm not going to bore you by reading all of the stats here, but you can see that there's very high rates of PTSD, depression, suicide, and substance use disorders here among the veteran population. And the PTSD isn't just necessarily from combat, it may also be from child trauma or sexual traumas. In fact, a lot of people join the military because it might be their only way out of a terrible situation. And so I think it's important that when we're talking about and talking to people who are struggling with drug or alcohol problems, that we consider there might be underlying things that they are trying to avoid or trying to self-medicate, or that may be driving the substance use. Next slide, please. At Easter Seals, Michigan, we're the largest mental health provider in the state of Michigan. And this is from a study we did a couple years ago, pre-COVID, looking at the numbers of substance use disorder diagnoses among children and adults. So we found that 3% of the kids, people under 18 who are coming to us it may be directly for substance use disorders or often mental health problems in general, depression, anxiety, trauma. About 3% had substance use disorders. The majority of those were cannabis related. And as cannabis has been legalized in Michigan and it's been the access has increased and normalized, it's interesting that now cannabis use disorders were higher than alcohol use disorders among our population. But even in general, across the country, we're seeing that kids are more likely to try marijuana than to try tobacco. And actually, there's often this incorrect conventional wisdom that marijuana is somehow safer than tobacco, which is actually often not true. Smoking anything is bad for you, and vaping is something we'll talk about shortly as well. I mean, in adults, as you'd expect, a higher rate, but almost a third of the adults we serve have substance use disorders. Alcohol and cannabis being the most common, which is expected because those are legal, but also other substances as well. This is just a graph depicting kind of the rates of those disorders again among our sample in 2019. Here's adults. And in the next slide, you'll see those other studies were from 2019. You'll see that these numbers have increased. We went from 29 to 31 and now 39% last year in our most recent data. And I think that speaks to increases that we've seen, unfortunately, during COVID as a direct result of the virus and fear and loss and grief, but also indirect results coming more from shutdowns and policies. And we know that for every 1% increase in unemployment, there are tens of thousands of people who die from suicides and overdoses. And so I think when you see, unfortunately, when access to healthy coping skills like going to the gym, going to school, going to church are decreased, and those things are closed, but liquor stores, casinos, marijuana dispensaries are open, people turn to what they have access to cope with the stress that they're dealing with. And so unfortunately, even before COVID, we were seeing huge spikes. You can see here over the last 20 years, increases in substance use disorders. But then you can see that rate of increased dramatically in 2020 when the pandemic started. And so this is something that people are struggling with all over the world. And that's why we want to talk about it today and raise some awareness. And so I'd like to introduce our panel now. First is Dr. Doru Bali. He wears many hats, but he's ER physician by training, and he's the medical director at MORC. We also have Stephen Norris, who is the Harm Reduction and Recovery Support Director at Alliance of Coalitions for Healthy Communities. And we have Wendy Standifer, who is the Director of Behavioral Health at Easter Seals, Michigan. So panelists, thank you for joining us. We are going to, for the next 30 minutes, have pre-planned questions for our panelists. But if you have any questions, please just put them in the chat. We have people who are monitoring the chat and will keep track of those questions. And then in the 10 minutes at the end of the panel, we will try to get to as many of those questions as possible. So if you think of any questions now or during the course, just please put them in the chat and we'll try to get to as many as we can at the end. Thank you. So now I'd like to turn to our panelists. First question is for Wendy. Sometimes people say that addiction is a moral failure or a sign of weakness. What do you think about that?
Well, first of all, thank you for having me, and hello to everybody. So it's neither. You know, it's a very complex disorder. It not only affects the brain functioning, but it also affects behavior. It's actually considered a serious disease, and that disease is not because of an unwillingness to stop, or moral weakness, or willpower.
Thanks, Wendy. Same question for you, Steve. What do you think about this idea that addiction is somehow a moral failure or a sign of weakness?
So I love this question, and I always like following Wendy's responses because it makes it so much easier for me to answer. You know, I think the question about whether it's a moral failure is like, at least from my experience, I'm in recovery long term. I've been a little over 8 years in recovery from substance use disorder. And I think that, it was one of those things that, I fought with that question and how do I answer that? Because it would kind of allude to the fact that I knew that there was a better choice for myself at the moment. And in that time of struggle, there wasn't that alternate path. There wasn't healthy mechanisms or coping mechanisms that I knew were available to me. So I found that most people that struggle with SUD are probably some of the strongest human beings that I've come to understand and know, just because they've been able to survive these things. And until we have more conversations like this and give them those options to choose better coping mechanisms, I don't think it's a form of weakness. I think it's a form of strength.
Thank you. I couldn't agree with both of you more. I think, unfortunately, oftentimes we get sidetracked and instead of focusing on how to help people, we start focusing on debates like, is this a disease or is this not a disease? And when people say that addiction is a disease, what they're saying is that it affects the brain, there's biological mechanisms that there requires treatment to help, that treatment can help people get better. And it's not just a matter of willpower, strength, or weakness. And when people say it's not a disease, I think what they're often saying is there are choices involved and there's responsibility involved. And all of those things are true. But I think the important thing is not to focus on whether it's a disease or not. I think I like to say needs over names. Let's focus on how to help people rather than on labels. No one's ever been shamed into recovery. Steve, so we know that some drugs are illegal, but with more illegal substances like alcohol, marijuana, prescription drugs, why is there such a stigma associated with this hidden pandemic? And does it affect people getting more help?
All right, so I don't get to go after Wendy, but I think there's a stigma associated, obviously, because there's a portion of substances that aren't legal to use. And those illegal substances, there's a stigma associated with it because it's considered illicit. We kind of hide in dark corners, hiding those ways that we cope in unhealthy ways with those drugs. But it's conversations like these. It's being able to get vulnerable and talk about it and let people know that it's okay, and that there are better choices available. I think that at least that's why I love being on this panel, so that people don't have to hide behind that stigma and they can openly say, hey, listen, I'm struggling with this and I need help. And that's what we're here to do.
Wendy, same question. How do you address the stigma?
So I love that I'm following Steve now. So I agree with all of that. I think another really important piece is to kind of look at stigma from there's three concepts you can kind of look at stigma, right? The first is stereotyping. There's a public conception that individuals suffering with SUD disorders have some type of negative characteristic. There's also this emotional response by the public that people are fearful or they'll display disgust to those suffering. And then there's also status loss and discrimination because they're perceived as less valued or treated unjustly. This directly impacts policy making so that resources, willingness of individuals to provide these types of services, screen or address those SUD issues, and it really limits individuals who are looking to seek treatment. So understanding all of that, looking at the brain role and how the brain and the functioning is impacted, really addressing stigma and all that we do is going to help reduce the negative perceptions, not only for the individuals that are suffering with the SUD disorders, but also for others in our communities and in the public.
That's great points. And I'd like to just add that, there's a lot of different kinds of stigma. There's societal stigma, but there's also self-stigma. And we know that 97% of people with substance use disorder won't seek treatment. And that might be because they're afraid of reactions or afraid of people finding out, which I think is important to note that treatment is confidential. Or it's because they feel like it's going to somehow be admitting that they're weak or that there's some sort of problem. And I think that most people will find that there's a whole lot of therapists, psychiatrists, other physicians out there that are ready and willing to help people in a non-judgmental way. And it's important that people recognize that that it's not a moral failure, not a weakness, like we said before. And hopefully we can help normalize that and fight that stigma. Wendy, how do we increase the hope factor for recovery?
So I love this. I love the aspect of hope. I love that we're talking about hope. There's all kinds of treatment in recovery that really looks at developing hope. We know it's a vital component of the psychological healing. It plays a critical role. It allows us to have a non-judgmental bond with individuals. It helps individuals foster relationships with others. But I think the biggest thing is incorporating it into treatment and increasing it so that individuals can reclaim that kind of sense of their self, letting them see that there's potential for a changed future. I love it. We want to build a hope reservoir, right? It's a container that we're going to give them hope, inspiring thoughts, sayings, affirmations. We use this all the time in treatment for a lot of individuals that we're working with. They don't seem to have that hope. They are lacking their meaning and purpose in life. So we'll say, I'm going to give you hope. I'm going to instill some hope in you that you can then pay forward. But it really, as we build that hope, we can build it into our treatment and in regards to our peer recovery coaches and activities. It's going to foster that hope and gratitude. And that's what we're really looking to do.
Thank you. Steve, same question. Can you talk about the hope factor for recovery?
Sure, this is my absolute favorite question. I love the hope angle too, as Wendy just eloquently put. I think that when we're talking about hope and we're talking about the 40 million people in the US that are affected with SUD, 22 million of those people are in active recovery and working towards bettering their lives. I always love to ring the bell that we're really good at collecting data now. And so over the years, we've started collecting data that 75% of people currently afflicted with an SUD disorder do and are recovering. So that's a huge, huge data point that we haven't really heard. So we're changing the language a little bit where we're talking about and also getting vulnerable, people sharing their stories that, yes, I had this issue. And you know what, I'm not, as you put, you know, I'm not morally failing, you know, I'm not weak. I have recovered. And this is a disease that, you know, most times if you were afflicted with the disease, the best case scenario is that, you know, you get treated. People in recovery, they not only recover, they become better human beings. And so there's a lot of hope in that. And there's a lot of hope in the people that are out there that are in recovery and on the path.
I just want to footstop what you just said. 75% of people in recovery. That's right. I think a lot of people don't realize that how many people are successful. And it's a tough battle. I mean, sometimes people go to try therapy multiple times over multiple years, and there's lapses and relapses, multiple stays in rehab. Some people one stay in rehab and they're able to maintain recovery for the rest of their life. Other people it's 10, 20 times, but don't give up. Sometimes it's just about the right timing for a certain person, or the right treatment, or the right connection with the right program or clinician. So don't give up. Dr. Bali, some people say that taking medication to help with addictions is just replacing one drug for another. Is that a helpful way of thinking about it?
No, I wouldn't say so. First of all, sometimes and oftentimes you do need that extra push or extra step to help with your addiction as well. Obviously, the whole recovery process is very comprehensive, right? It's anywhere from cognitive behavioral therapy to, like you stated, seeing what the underlying trauma is, but then ultimately also you will need some potential help, to either replace the withdrawal symptoms that is oftentimes and sometimes can be very detrimental to physical health, but then continuing on afterwards as well to replace those cravings as you deal with all the other emotional aspects of the addiction process. I think is very, very important. So I will not equate as replacing one harmful drug with another one as continuing that addiction process. It's actually quite the opposite.
Great, thank you. Steve, same question. What do you think about that idea? You're just replacing one drug with another.
Yeah, great question. Great response too. MAT or medical assisted treatment is a part of recovery, and there are a lot of multiple pathways to recover. Some are very, very effective and useful for a lot of people. And I think, again, the more and more we talk about this, the more we get away from being closed-minded to there's only one way. That keeps us stuck and keeps the stigma rolling that there aren't better alternatives out there that could be a use of medication to kind of get a leg up too. There's so much scientific evidence and data about the brain chemistry and the effects that that some of these drugs have on it, that sometimes those things are necessary for a full and healthy recovery for people.
Yeah, great points. And there are so many medications out there, particularly for opioid use disorder. A lot of people are familiar with methadone or buprenorphine, which is also known as Suboxone. For alcohol use disorder, there's naltrexone and camprosate. For nicotine replacement therapy and varenicline, there's lots of medicines out there. And those medicines, you got to remember, taking buprenorphine and taking heroin, those are two very different things. One is much higher potency than the other. One is regulated. One may be tainted with fentanyl or who knows what. And so to taking a pill versus injecting or snorting a drug is vastly different, especially when you're taking that under the guidance of a physician. And we know the evidence is quite clear that people are much more likely to be successful in their recovery if they have that comprehensive treatment plan that Dr. Bali talked about, that's biopsychosocial, that you're having that medication and therapy, going to groups, going to 12 steps, having peer support, all of those things. And finally, I'd just like to add that sometimes you hear it's a crutch. That's just a crutch. And my response to that is, well, what is a crutch? A crutch is something that people use to heal and recover and function. And sometimes people have a surgery or an injury and they use crutches short term, and they're able to then walk without crutches again. Some people have to use crutches the rest of their life, either because of an injury or maybe because of a disease, maybe muscular dystrophy or cerebral palsy. And it would be cruel to deny any one of them a crutch to help them live their lives and recover. And the same goes for substance use disorders. Sometimes people will take medicine and be in treatment forever, and some people will be in treatment short term, and sometimes they stop and they need to get back in treatment. And so whatever it takes to help people live healthy, functional lives and be their best self, have those relationships, people are able to work, live, love, drive, do all the things they need to with these medicines. And that's a lot better than we can say about some of the more dangerous street drugs, right? All right, I'll get off my soapbox for a second. Back to Dr. Bali. We mentioned vaping earlier. Is vaping addictive? And could you talk about what popcorn lung is?
Yeah, vaping is definitely addictive, right? Because it contains chemical, kind of like a chemical components that we don't necessarily know exactly what's inside. And then there's some of them that are probably considered cleaner than others, but ultimately it's still very similar to nicotine. However, other than smoking regular cigarettes, in terms of what's involved in vaping, and then what we've seen when we had a series of popcorn lungs and that mysterious lung disease that a lot of vapors had not too long ago, it's a chemical reaction, right, that takes place as part of that little cartridge. And when they do smoke it, the chemical reaction, it pretty much hardens and it literally burns your small airways. And that's pretty much how you exchange oxygen between the blood and your airways. So once those are burned out, pretty much you're going to have a lot of scarring, a lot of issues, and a lot of people needing lung transplants and other extreme therapies to get over that.
Yeah, it's really frightening. And I just want to add, I have talked to so many people in my personal life and professionally, my patients and particularly kids. I have heard so many people say that, oh, it's not addictive, it's just water or it's just fruit or something like that. Usually those cartridges either have nicotine or they have some sort of cannabinoid in there, like cannabis or marijuana or something derived from that. And so those things are addictive as well. And smoke is harmful, but those vape particles, those chemicals can also be harmful. So it's important for people to make informed decisions about what they're putting in their body. And a lot of times they really don't know. Wendy, are individuals who use substances at a higher risk for suicide?
Absolutely. So we already know that there's a lot of different factors that play a role in individuals that are suffering with suicidal thoughts or having plans, but we know that the SUD disorders add to that, right? That there's an increase of comorbidity that occurs. We also know that individuals that suffer with SUD addictions, it's usually about 1 in 12 adults. You'll start seeing that there's a higher level of depression, and there's more of individuals that attempt. And we know that the percentage of individuals that do complete death by suicide, over 22% of them had some type of alcohol intoxication during that time, and 20 to 25% have some opiates in their system. So it's very much highly correlated with each other, and we want to be, it's something as it is that we're addressing, but when you have those issues, you know, we know immediately most individuals that have gone through it, the minute they try something, they immediately regret it. It's not that they talk about they're not really in their right mindset when it happens. So by using a substance or by using alcohol or drugs, it's definitely altering their cognitive thinking during that time period.
Yeah, that's a great point. I've heard it said that up to 50% of people who die by suicide were intoxicated, whether it be alcohol or drugs. And so, you know, those substances can cause or worsen depression. And even if there's some euphoria or good feelings in the short term, it can worsen those in the long term. But they also disinhibit people, and you end up behaving in a way that's different than you might normally. And like I was saying before, I think especially during times of stress, like everybody's been dealing with in the last few years, we go to coping skills. We use different kinds of things or activities or skills to cope. And the way I kind of think about coping skills is that we all have kind of a go-to list that we may be conscious of, or maybe it's unconscious, but when we're stressed, we go to do something. Maybe it's sitting on the couch and watching TV, but everywhere on all of our lists, somewhere on there appears drugs, alcohol, suicide. It might be number 1,000 on your list. You might have to burn through 999 other coping skills before you get to that point, but it might be number 3 on my list. And part of what we try to do in treatment is hopefully put some healthier coping skills on that list and move those unhealthy coping skills down the list. But as I said before, during COVID, some of those healthy coping skills were just, we don't have as much access to do those things. And so that's unfortunately why we've seen so many people start substance use for the first time in their life, or relapse after being in recovery for a long time, or increase their use during this stressful time. So I know we've been going really fast, and there's some questions I see in the chat. So first question, and anyone on the panel is welcome to answer, and including more than one, just not at the same time, I guess. So question, is there a hope that the rates will go down as things are opening up again?
Well, I can jump in on this one if you'd like. Yeah, we'd love to hope that rates would go down as things open up. And, you know, a big part of recovery is not feeling alone. So if people have not decided to come back into a structure where they can be vulnerable with people that are having these issues, this is the time for us to encourage them to do it. However, there are, you know, multiple options for them. There's virtual meetings, there's virtual fellowships, and I think we see from the data that as social creatures, we're better connected together than we are isolated and alone.
Yeah, I think that's a great point. I think everyone's hopeful that you know, things will get better as the virus wanes, but unfortunately, the effects of trauma can last for years and decades. And we know that there's been increased, as people have been trapped together under stressful situations, there's been increased rates of domestic violence and child abuse, and those things may affect people for years, decades, or the rest of their lives in some cases. But it's still, on the flip side of that, is going back to that hope factor again. If we can get people help, the sooner the better, and whether it be about addiction, trauma, or both, the sooner we can intervene and help people and get our loved ones help, the better. Another question, what advice can you give families that have a loved one going through substance abuse?
I can start with that one. So there's a lot of resources that are out there. There's Al-Anon, and there's other support groups for families. But I think one of the biggest things is also taking care of yourself. I think that a lot of times families feel helpless and they feel hopeless, and there's sometimes that the individuals that they love are not ready for treatment and really resistant to treatment. So there's a lot of great resources and communities that can help you navigate it as a family. It's kind of that same premise, like when you're on an airplane, you got to put your oxygen mask on first before you put on your loved one's oxygen mask. So I would recommend to kind of, as best as you can, take care of yourself, because sometimes it's really difficult to be there for support when you yourself are struggling.
That's a great point. Yeah, that oxygen mask analogy I think is really important. And I know as a doctor, sometimes we're the worst patients, right? We don't practice what we preach, but it's really important when you have a family member that you're taking care of yourself too. And I think it's very easy to fall to one extreme or the other when you have a loved one. Sometimes people are really, really engaging that tough love to the extreme. And sometimes people are enabling, and I've even heard of people going out and buying drugs for their family member so they won't go through withdrawal, and in their mind they think they're helping.
Right.
And I think it's important to find a balance, to make sure you're taking care of yourself, you're setting boundaries, but you're also providing support. You can be very supportive and have boundaries and expectations. Both can be true at the same time. Sometimes it's easier said than done, but being in your own treatment, your own therapy, going to groups, whether it's Al-Anon or other resources, can sometimes help you find that balance and learn new tools. Dr. Bali, are you seeing younger people present more in the ER with addiction issues?
We are, and it's mostly THC or cannabis-related illnesses. Ever since it started to become more of a norm, right, to use those kind of substances, we're using a lot of vomiting associated with it. Some people call it cyclical vomiting syndrome, but it's mostly, cannabinoid hyperemesis syndrome that was actually recognized by University of Michigan quite a few years ago. So we're seeing a lot more, I think, especially during the pandemic, I think a lot more use, and not just substance use disorders, but we're seeing a lot of anxiety and depression related physical symptoms, right? Younger people coming with chest pain or anxiety or hyperventilation syndrome, panic attacks, just because of what has been going on through the pandemic as well. So we're seeing a little bit of both, definitely increase in the emergency department.
Yeah, I've seen the same thing. And I think, it took 70 years, but finally people believe that tobacco causes problems, right? It's pretty wide known, but now we're kind of in the early stages of cannabis, and people believing that it's harmless, that it's all natural and it's less dangerous somehow. Well, marijuana and tobacco are both natural. So is arsenic, so is opium, so are a lot of things out there. Just because something is natural doesn't mean it's not harmful. And when you smoke a plant like marijuana, there's 200 chemicals that you're inhaling into your body. And regardless of whether I'm smoking marijuana or tobacco or just a rolled up piece of paper, those smoke particles will affect your lungs. They increase the risk of heart and lung disease, of cancer. And then finally, I not to mention that smoking marijuana especially before the age of 25, increases your risk of having a serious mental illness like schizophrenia or bipolar disorder by about 2 to 3 times. And I think people just do not realize that. There was a study came out this summer that said Amsterdam, which has, if I'm not mistaken, was the first place in the world to legalize marijuana. So they have decades of data. They estimate that about 50% of people who have schizophrenia right now, that was caused by marijuana. So it's very important that, again, this doesn't happen to most people who smoke marijuana, but people should be aware of the risks. There's risks. There's risks if you're pregnant and you smoke. There's risks if you're depressed or anxious. There's risks if you're driving and you use marijuana. We got to be aware of these things. Someone said, where can we get Narcan?
So
And
I
is
can
there
jump.
free Narcan?
Yeah, so I can jump in on this. The Alliance of Coalitions does community trainings. We did 23 last month. We hold bi-weekly trainings for the community online for free Narcan distributions. We're not the only game in town. Easter Seals is a partner of ours we provide Narcan for. But if you wanted training and free Narcan, we've supplied over 6,000 doses to the community this last year and trained so many people. So it is available. You can contact any of the people, organizations that deal with SUD. And we actually have a live Narcan training tomorrow evening. So you can check that out on the Alliance's website.
Thank you. Yes, and I see a question. Can you repeat the name? It's the Alliance of Coalitions for Healthy Communities. And so they're one of many organizations out there providing Narcan and Narcan training. And I think it's a good idea for people to have, especially if you know or personally have an addiction or know someone who does. I know I keep Narcan in my car and in my house just in case. And I have multiple times in my personal life, not my professional life, come across people who are overdosing. So and you can save a life. And I won't take the thunder away from the training. You should go to the training and learn about this. But it's something that it's not harmful to give someone if they're unconscious from something else. So you can give it to someone, and if they are overdosing from opioids, it could save their life. If it's something else, it's not going to hurt them. So it's a life-saving treatment.
You can also get it without a prescription at the drugstores. You do have to pay for it, but it is available without a prescription.
That's a great point. Thank you, Dr. Bali. Why is it dangerous of people to abruptly quit using substances cold turkey?
I can take that one. So alcohol is very well known to, it's probably one of the few actually substances that if you stop cold turkey, especially if you are highly addicted to it, if your body is highly used to it, where you can actually die, right? Once you go in what we call delirium tremens, when you're shaking, you're hallucinating, your vital signs are abnormal, there's a 10 to 30% actually mortality rate, right? So from that alone. From a substance use in terms of, let's say stimulants or heroin or anything like that, obviously it can cause, from heroin withdrawal, you can have a lot of vomiting and diarrhea, and you can have electrolyte imbalance, which can be harmful. From stimulant withdrawal, I think it's more or less just the more and more you crave, and oftentimes you could try to do a cold turkey, and then you oftentimes, revert back to using, and that first use is actually can be quite dangerous, right? To try to deal with your own symptoms. And oftentimes we see this in opioid addiction when they try to go cold turkey and then they go to it back again, and then maybe your last time that you use, right? Because it can be fatal.
Yeah, that's a great point. I think a lot of people are aware that overdoses can kill you, and an overdose in anything, any substance, any drug, alcohol, even drinking too much water, too much of anything, even a good thing, it can harm you. But there are certain substances that can cause death through withdrawal. Like Dr. Bali said, alcohol is one of them. A lot of sedatives like Xanax or Ativan, those things can, in withdrawal, people can die from them. Their brain has been so sedated for so long that without that sedation, their brain kind of goes into overdrive and they start having heart arrhythmias, seizures, all of those problems that Dr. Bali said. But the other issue, just besides the harm, is your success of treatment. We know that people who go cold turkey on their own, and by the way, the reason it's called cold turkey is because when people withdraw from opioids, they tend to get goosebumps and their skin gets cold and it kind of looks like cold turkey. And so people are really uncomfortable during that time. And if they're just trying to do it on their own, they're trying to lock themselves up in a room, or there's actually a high chance that they're going to go use because they're so uncomfortable and they're in so much pain. And they know all they have to do to make that pain go away is go take those substances. And so we know, depending on the substance, about 1 to 5% of people who try to go cold turkey without any support, only 1 to 5% are going to end up maintaining recovery a year later. So 95 to 99% of people are going to relapse. They're going to use again. So having that biopsychosocial comprehensive approach, getting that support, whether they're groups, therapy, maybe it's a 12-step program, maybe it's a different organization. And even within 12-step, if you've gone to one group, you've gone to one group. There's a lot of different groups out there with different mentalities. There's women's groups, there's professional groups. Get that support. And at least when it comes to alcohol, opioids, and nicotine, medication can really increase your chances of success and recovery. In regard to MAT, medication-assisted treatment, it is my understanding that individuals could be on this drug therapy for the remaining of their lives. But for some who don't want to replace one drug for another, what is the best timeline for treatments such as Suboxone and Vivitrol? I think I'll take this. I'm a board-certified psychiatrist and addiction medicine physician, and there is no set timeline. It's different strokes for different folks. However, generally my recommendation is, if it ain't broke, don't fix it. If someone is being successful and their relationships are improving, they're able to work again, and they're not having side effects and they're doing well on the medicine, often I'm going to recommend that they stay on that medicine, maybe the rest of their lives. If we're going to stop, just like you don't want to stop cold turkey with illicit drug, when it comes to something like Suboxone or methadone or Vivitrol, we want to stop it slowly, and because people can still have a mild withdrawal that's uncomfortable for them. And so we would want to taper it very slowly. And if there's any signs of problems, we want to stay still or maybe even go back up on that dose. And so this is something that really depends on you and your situation, but also working with your doctor to figure out the best plan for you. Let's see, sorry. If a person considered addicted to alcohol, if they consume 3 to 4 alcoholic beverages daily.
Wendy, you got this. Yeah, go for it.
I was gonna say, who wants to take that one?
That's a tough one.
It's a little bit more complicated than that. It's not just an individual's consumption. I mean, there's all kinds of like little screening tools to look at what the concerns are. But if somebody's drinking 3 or 4 a day, there's probably more stuff going on. It really is also about their functioning and how it's impacting their functioning. I think Dr. Ganay talked about it earlier. We all have ineffective and unhealthy coping skills. So there's a lot that you can do, because there's a piece that's prevention, to start educating on what could lead to addiction. So there's not a clear-cut answer, but I would definitely want to look at that a little bit more closely.
That's right. The more you use, the more at risk you are of developing an addiction, but there's no a certain amount that's the cutoff, and it's above this, it's about functioning. Is it affecting your relationships? Is it affecting your work? Is it affecting your health? Is it affecting your mental health? So thank you so much. I'm going to turn it over to Reagan, but this is such an important topic, and I think having discussions open and honestly about this will be a big step forward to fighting stigma and getting people the help they need. Thank you. Turn it over to Reagan.
We want to let you all know that you are not alone in this, and there is hope for today, as we mentioned, and hope for the future. Let's all remember that addiction affects not only the person that is struggling, but all of those around them. And we wanted to share with you as we close out some of our local resources and our national resources on the next 2 slides. I will share this with everyone ahead of time or after the meeting, but we wanted to make sure that you have these at your fingertips. Please feel free to share those with others in your life. Thank you for taking the time today to join us for today's webinar, and thank you to our amazing panelists.